Today I'm going to be talking about non-Hodgkin's lymphoma and a patient's diagnosis and treatment with this disease. The cancer targets the lymphatic system, which is the disease-fighting system in the body. It is made up of lymph nodes, the spleen, the thymus gland, and the bone marrow. Non-Hodgkin's lymphoma is one of the two major kinds of lymphoma, which is a cancer caused by the excessive and uncontrolled multiplication of small white blood cells specific to the lymphatic system, known as lymphocytes. It makes up approximately 4.3% of all new cancer cases in the United States. There are different types and ways of categorizing the cancer, including the origin of the cancer and the pace of growth. Non-Hodgkin's lymphoma can originate in either B cells, which is the most common occurrence, or T cells. They can also have an indolent or low-grade pace of growth, which means they grow slowly and there are few symptoms. Or they can have aggressive or intermediate or high-grade paces of growth, which causes the lymphoma to grow and spread more quickly and have more severe symptoms. The patient, Ariel Rosen, was a 40-year-old female that went to her general practitioner complaining of chest pain. She received chest x-rays and was ultimately misdiagnosed with costochondritis. In the coming days, she experienced more symptoms, including a loss of appetite and noticeable drop in weight. However, it wasn't until her lymph nodes in her neck and throat area swelled suddenly that she decided to go back to her doctor. She was once again misdiagnosed with mono. 2 weeks later, she was still experiencing severe symptoms, so she went back to urgent care, where she received a fine needle aspiration in order to determine a differential diagnosis. In order to diagnose non-Hodgkin's lymphoma, there are a few tests that can be done. A physical exam to check for swollen lymph nodes or swollen spleen or liver is an initial indication of non-Hodgkin's lymphoma. A blood test can also be done, in which the white blood cell count and the levels of LDH are assessed. A high level of white blood cells and LDH is another indication of non-Hodgkin's lymphoma. The most definitive method of testing for non-Hodgkin's lymphoma is biopsies. Ariel first received a fine needle aspiration, which takes a small sample of the lymph node. The results of this biopsy allowed for her diagnosis. Other types of biopsies include an incisional biopsy, which takes a larger part of the lymph node, and an excisional biopsy, which removes the entire lymph node. Ariel also received an excisional biopsy after her diagnosis, and the entire tumor was removed. Her testing showed that she had primary metastatic large B-cell non-Hodgkin's lymphoma, a fast-growing type of non-Hodgkin's lymphoma that originates in B cells. Her doctors then moved on to treatment. The most common ways of treating non-Hodgkin's lymphoma include chemotherapy, radiation therapy, and bone marrow transplant, or other drugs used to aid the body's immune system in its fight against cancer. Ariel was treated as an inpatient living in the hospital with dose-adjusted R-epoch chemotherapy. The EPOCH just refers, and the R refers to the drugs that were used for this version of chemotherapy. Her chemo would occur in 6 cycles, each cycle lasting for 3 weeks. In the first week of the cycle, she received a continuous infusion of the drugs into her arm or chest for 24 hours a day, lasting 5 to 6 days. The next 2 weeks, she dealt with the side effects and rested as she waited for her white blood cell count to recover. After 4 cycles of treatment, Ariel was given a PET scan and a CT scan to determine the status of her cancer. Both scans were clear, and she continued her treatment for the next 2 cycles. After those 2 cycles, she was sent home. 2 months later, she returned to the hospital and got another PET scan and CT scan, which again were clear. She was officially in remission after those scans, and she continues to be cancer-free to this day.